Even John Fetterman thinks that everybody should have access to these new GLP-1 medicines. He goes on to talk about how Trump nixed the Biden's administration's rule that was going to make it easier for people to get these medicines that I keep talking about. They are game changers. They change everything when it comes to metabolic health. It turns out he knows firsthand how well these things work. He was started on Mounjaro, which is tirzepatide, a GLP-1/GIP co-receptor agonist. Just like all my patients say, it not only helped him lose weight, but his head felt clear. It was almost like he felt like a normal person feels who doesn't struggle with their weight. One of the big issues is coverage, though. Medicare and Medicaid don't readily cover these medicines. Biden set out to change that by nixing that rule and hopefully make it covered by Medicare and Medicaid. Unfortunately, the Trump administration nixed that nixing of the rule. And people argue, though, that we don't want a bloated system. We don't want Medicare and Medicaid to pay for these because they're so expensive, it'll make healthcare super expensive. Senator Fetterman argues that if they do cover it, they have the negotiating power to make them a lot cheaper. Is that true? I don't know. I do agree with Senator Fetterman about that. Like, we need to have these drugs in access. And again, I don't make money. He's not making money from promoting this. I don't make money from prescribing these drugs. They are just amazing. My patients are just doing so well when they've struggled for so many years and they finally feel like they have hope. Again, if I think we're going to try to make America healthy again, like RFK and everybody else wants to, we need access to these medicines. Food alone and changing the environment will not do it. Changing the environment is going to be impossible to put it back 100 years like it was before. Another argument is that we make these medicines so much cheaper. We get rid of the middlemen, the PBMs, these pharmacy benefit managers, in between the patient's insurance and the manufacturer. We just make these medicines so cheap, like other countries, $50 to $100 a month. Forget insurance. Let's stop bloating insurance. Let's just make them affordable so most people can get them. The people that are indigent, can't afford anything, sure, we cover it. And then they're super cheap. That's another option. But either way, everybody needs access to these medicines. We're not going to make America healthy without them.